Popular film depictions of electroconvulsive therapy show a terrifying, punitive procedure administered without consent to fully conscious, restrained patients. Modern ECT bears almost no resemblance to this portrayal. Performed under full general anesthesia with muscle relaxants, it remains, according to decades of rigorous clinical evidence, one of the most effective treatments available for severe, treatment-resistant depression, a striking gap between cultural perception and clinical reality. Modern electroconvulsive therapy is performed under full general anesthesia combined with a muscle relaxant medication, producing a brief, medically controlled seizure lasting approximately 30 to 60 seconds, monitored continuously through EEG and other physiological monitoring throughout the procedure, with the muscle relaxant preventing the visible physical convulsions associated with popular media depictions and historical, pre-modern administration, meaning the patient experiences the seizure entirely while fully anesthetized and shows no outward violent movement, a dramatic contrast to how the procedure is commonly imagined. A typical course of electroconvulsive therapy involves approximately 6 to 12 individual treatment sessions administered 2 to 3 times per week over several weeks, most commonly used for severe, treatment-resistant major depression that has not adequately responded to multiple trials of antidepressant medication and psychotherapy, and for specific severe, urgent presentations including active suicidality, catatonia, and severe depression during pregnancy, where medication options carry additional risk, situations in which ECT's comparatively rapid onset of therapeutic effect provides significant clinical advantage. Rigorous meta-analyses of ECT effectiveness for severe, treatment-resistant depression consistently find response rates in the range of 50 to 70%, among the highest response rates documented for any available depression treatment, including pharmacological options, and notably including substantial effectiveness for patients who have already failed to respond to multiple different antidepressant medications, making ECT a particularly valuable option specifically for the most severe, difficult-to-treat depression cases where other interventions have already proven insufficient. The most significant genuine, well-documented side effect of electroconvulsive therapy is memory impairment, particularly affecting memory for events occurring around the time of treatment, called anterograde and retrograde amnesia specific to the treatment period, which for most patients resolves substantially within weeks to months following treatment completion, though a smaller subset of patients report more persistent memory difficulties, an area of ongoing research and refinement, including newer unilateral electrode placement and ultra-brief pulse width techniques specifically developed to reduce cognitive side effects while preserving therapeutic effectiveness. Transcranial magnetic stimulation, or TMS, offers a non-invasive alternative brain stimulation treatment for depression, using focused magnetic pulses delivered through a coil placed against the scalp to stimulate specific, targeted brain regions, most commonly the left dorsolateral prefrontal cortex, implicated in mood regulation, without requiring anesthesia, without inducing a seizure, and without the memory-related side effects associated with ECT, though TMS generally shows somewhat more modest effectiveness than ECT specifically for the most severe, treatment-resistant depression cases. Transcranial magnetic stimulation received FDA approval specifically for treatment-resistant depression and is typically administered daily, 5 days per week, over a course of approximately 4 to 6 weeks in an outpatient clinical setting, allowing patients to resume normal daily activities, including driving, immediately following each individual treatment session, unlike ECT, which requires anesthesia recovery time and typically some restriction on independent activity, including driving, on treatment days specifically. Electroconvulsive therapy, despite its persistent and inaccurate popular portrayal, remains a rigorously evidence-based, highly effective treatment for the most severe forms of depression when administered using modern, humane clinical protocols under full anesthesia, alongside newer, less invasive alternatives like transcranial magnetic stimulation. Brain stimulation therapies offer genuinely valuable options for patients who have not responded to more conventional treatment approaches.